Okay, we're gonna start with scanning the room. So here is the walls of the room. The ceiling. And the floor. See the floor by the bed. The floor over here by the table. My name is Susan Farnsworth. Today's April 5th, 2024. This is my head-to-toe assessment in the spring semester for the University of Memphis. So we're going to start by assessing the skin of the whole body. When we assess the skin, we want to look at the color, the temperature, the turgor, the texture, any edema, bruising, nevi, lesions. Then we'll start with the head and face assessment. So first we assess the size of the head, the shape, if it's midline. Then we move on to palpate the head. We're feeling for any indentations, bumps. We look for distribution of the hair, the color of the hair. We also look for any infestations. Then we move on to the temporal arteries, feeling for any tenderness. Then we move on to the lymph nodes. So we start with the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, the submental, the posterior cervical, the anterior cervical, and the supraclavicular. Then I'm going to palpate the temporomandibular joint. Can you open and close? Feeling for any subluxation, any crepitus. And then to assess cranial nerve number 5, I'm going to have him clench his jaw. I can feel the masseter muscle. Then to assess cranial nerve number 7, I'm going to have him smile and frown and puff your cheeks and pucker your lips and raise your eyebrows. Good. Now we're going to move on to the ears. Again, we're going to assess the ears, see if they're midline, proper placement. I'm going to palpate the pinna and the tragus to feel for any masses or lesions. I'm going to use my otoscope to assess the tympanic membranes. I look in there and see pearly gray. Good. Then I'm going to perform the whisper test. So I'm going to have him cover this ear and I'm going to whisper. Can you hear me?
Yes.
And do it on this side, cover the other ear. Can you hear me?
Yes.
Then I'm going to use the tuning fork to do the Rena exam. So you feel the vibration?
Mm-hmm. Can hear it slow.
That side.
Mm-hmm.
Place that on the mastoid bone. And for the Weber test, can you hear that bilaterally or more on one side than the other?
We're on the right side.
Okay. Then we move on to the eyes. I'm going to first inspect eyebrows, eyelashes, palpebral fissures. I'm also going to look at the sclera of the eyes, the conjunctiva of both eyes, note any redness, drainage, any changes in color. Then to assess cranial nerve number 2, I'm going to do a visual acuity test This would typically be 20 feet away, but I want you to cover one eye and read the smallest line that you can.
LTFPH.
Okay, and then the other eye.
LTFPH.
Okay, good job. Then I'm going to assess cranial nerve number 3 with the pupillary reflex. So just look straight ahead. Sorry, this is really bright. And I'm also going to test for accommodation and convergence of the eyes. So watch my finger. Good. I also want to use my ophthalmoscope to look for the red reflex in both of the eyes. So go ahead and look at the T on that. Good. I would also use this to assess other structures of the eye. Then I also want to assess cranial nerves 3, 4, and 6 by testing extraocular movement. So follow this with your eyes. Good. Okay, now we'll move on to the nose. Again, we're assessing the midline, if it's midline, the straightness of the nose. I'll test for cranial nerve number 1. So plug one side, just one nostril. Can you smell that?
Mm-hmm.
Okay, now plug the other nostril. Can you smell that?
I did.
Okay.
Not as well, for sure.
I can also look at patency of the nares by having the patient look up and assessing it with my light. I also want to assess the maxillary and the frontal sinuses for any tenderness. Then we move on to the mouth and the throat. With the mouth, I would assess the lips, the gums, the teeth, the buccal mucosa, also underneath the tongue, the hard palate, the soft palate, and the tonsils, and I would note the grade of the tonsils if they're present. I would test cranial nerve number 9 by having him, so open your mouth, use my light on here, and stick your tongue out and say ah. I can assess that by seeing the uvula and the soft palate rise. After the throat, we move on to the neck. Again, I want to look at the skin. I want to know any abnormalities. I want to look at or assess the midline of the trachea. I also want to assess the thyroid. So I come from behind. Can you swallow? Okay, good. I would also assess the carotid pulses on both sides. And listen for carotid bruits on both sides. Okay, I'm going to have you turn around, so face the other direction. I'm going to start the assessment of his posterior chest. First, I would look at the skin again, color, temperature, turgor, texture, any discoloration, bruising, edema, lesions, nevi. First, I would feel for chest expansion, so just breathe normally. Good. And then I would also palpate for fremitus, so say 99,
99,
and again,
99,
and again.
99,
Then I would auscultate all of the lung fields in the. Oh, first, I want to palpate each area. Percuss each area, not palpate. Then I would want to listen with my stethoscope, like breath sounds. Take a deep breath. I could also at this point assess for bronchophony and I can't remember the other word right at the moment. So while I'm listening to his lungs, I would have him say 99.
99, 99,
Could also have him say E.
E,
Again.
E,
And I could also test for pectoriloquy. Say whisper 1, 2, 3. None of those were heard clearly. Okay, now I'm gonna have you turn around and face me again. I want to then assess the anterior chest. Again, looking at the skin, you always want to know the color, the temperature, if there's moisture, if there's nevi or lesions, any edema, anything like that. Again, I'm going to palpate for fremitus, so say 99.
99, 99, 99,
Okay, and then I'm going to auscultate each of those areas. Take a deep breath. And then go the right way. Okay, good. Now I'm going to have you lie down. So go ahead and put your head on there. I'm going to have him lie at a 30 to 45 degree angle to assess for jugular venous distension in the neck. I also, I'm going to go around the other side. Oh, I had you lay down too fast. That's okay. I'll start by assessing his heart while lying down. I would typically have him sit up first, but we'll start by doing it in the supine position and then come back and auscultate the heart again. But I would start at the aortic point in the right intercostal space for the aorta, and then move to the left intercostal space for the pulmonic, third intercostal space for Erb's point, fourth intercostal space for the tricuspid valve, fifth for the mitral valve, and also the PMI. I'm also going to palpate for the PMI, and I would also palpate each area for any thrills. I'm going to do his abdominal assessment and then go back and listen to his heart again. I would, again, assess the skin of his abdomen, noting shape, contour, symmetry. I would start by listening to each of the 4 quadrants for vowel sounds. Then I would percuss in each of the 4 quadrants. And then I would palpate in each of the 4 quadrants. In the right upper quadrant, I would feel for liver enlargement, and in the left upper quadrant, I would feel for an enlarged spleen. Good. I would also assess the aorta, the renal arteries, the iliac arteries, and the femoral arteries. Okay, go ahead and sit up. I'd also assessed for costovertebral angle tenderness, so tenderness there. Okay, go ahead and move your feet to the front. So I'm going to go back and assess the heart while he's sitting up. So again, in the right, second intercostal space for the aorta. Over to the left, second intercostal space for the pulmonic. Third for Erb's point. Fourth for the tricuspid valve. Fifth intercostal space for the mitral valve, and also the PMI. I would also listen for the listen to the apical pulse for a full 1 minute to listen for the rate and the rhythm. Okay, heart, abdomen. Then we move on to the musculoskeletal exam. Again, I would assess the skin, start with the upper extremities. Again, looking for color, moisture, temperature, nevi, lesions, any edema, and just any abnormalities. I'd also look at the symmetry of the extremities. I'd also palpate each of the joints, so the hands and fingers, the wrists, the elbows, and the shoulders of both sides, looking for nodules, looking for crepitus, tenderness. So let's start with testing your, not your reflexes, but testing the strength of your hands. So flex your hands, extend your hands, hyperextend your hands, good. And then flex your wrists, extend your wrists, hyperextend your wrists, good. And flex your elbows, and extend your elbows, and hyperextend your elbows. And then your shoulders, you can flex forward and back and extend, good. And then we'll test the strength. I also want to note capillary refill of the fingers. So squeeze my fingers, okay, and then we're going to test biceps. So hold your arms up this way and don't let me pull, good. No, don't let me push, good. And let's see. Have you shrugged your shoulders? That's cranial nerve 11. Can you do that while against resistance? Good. We want to test cerebellar function. So let's have you do rapid alternating movements. So just palms up, just rapid switch. Can you do finger to thumb on each? Good. And push your fingers together. Good. Now we're going to move on to lower extremities. Again, I want to note the skin and any changes of the skin. I also want to feel for dorsalis pedis pulses on both sides, and also posterior tibial pulses on both sides. Good. Then I want to assess each of the joints again. Feel the toes, the ankles, the knees, and the hips on both sides, looking for any nodules, pain, swelling. Now let's start by flexing your toes, squeezing your toes in. Good. Extend your toes, hyperextend your toes. You do it on this side. Good. Okay, now flex your ankles up and extend your ankles straight. Hyperextend. Can you invert them? Can you evert them? Can you turn them in circles? Good. Now let's flex your knee. Just bend it in. There you go. And extend it. Hyperextend it. Good. And then we'll do hips in a minute. Let's test the strength of your ankles. So let's see. You've seen that. So push like you're pushing the gas pedal. Good. And push my hands up. Good. Now don't let me push your legs back. Good. And then good. All right, let's have you stand. So we're gonna assess the hips. So let's see. Let's flex the hips on both sides. Okay, and this one. And extend to the lateral and lateral. Good. And can you turn your feet in and turn your feet out and circle your legs. Good. Now turn around. I'm going to assess his spine. I want to look at for any scoliosis or abnormalities. So bend forward. So we'll flex your spine. Okay, stand up. So that's extending your spine. Can you lean back and hyperextend your spine? Good. Now let's do the same, or lean lateral. So lean to the left, good. Lean to the right, good. And then twist, so turn, yep. Turn the other way, good. Now let's do the same with your cervical spine. So flex your cervical spine, extend, hyperextend, perfect. Can you turn it laterally? And then go in a circle. Good. Good. Now turn back around. Now we're going to test Romberg. So feet hip distance apart. So a little bit further. Cross your arms. We're looking for any swing, any motion. That looks good. Can you walk heel to toe? Good. And can you hop on one foot? Good. And hop on the other foot. Good. We also want to test, you can sit, just for light sensation. So can you feel that?
Yes. Yes.
Okay. And then we also lastly want to test your deep tendon reflexes. So we'll start with the brachioradialis. So there. And on this side. And then we want to do your biceps. And then let's do your triceps. So go ahead and hang that down. All right, it's hard to see. Let's do this side. Let me hold your arm. There you go. Okay, and then we want to do the patellar reflexes. There we go. And then the Achilles. So go ahead and rest your foot. Or relax your foot. There you go. Okay. Relax your foot. Okay, good. And I believe that is the end of my head to toe assessment.